Hello, friends. I'm back again. Good morning, good afternoon, good evening, depending on which continent you are hearing my voice and you are watching my video. Today, I'll be talking to us on topic titled One Virus, Two Manifestations. Again, I'm Professor Festus Sadu of the World of Viruses, Chickenpox and Shingles. This is what I'm talking to us about today. Chickenpox and shingles. This virus belongs to the herpes virus group. Chickenpox and shingles are not the same. Chickenpox affects children, whereas shingles affect adults. You can see it from the picture on the right, a chickenpox in a child, and the same shingles in the same adult, in the same child as this time as an adult. That's why I say one virus, two manifestations. They are the same virus. They belong to the herpes virus family. They belong to the herpes virus family, but they cause different clinical manifestations. Varicella zoster is the primary infection. And how is it transmitted? Varicella, which is the primary infection, which is the chickenpox actually, how is it transmitted? It's transmitted through direct contact or through respiratory transmission, by inhaling, sneezing, and coughing. It's a highly contagious disease. Virus infects the upper respiratory tract and spreads to the skin. Virus migrates to the dorsal, please know this. Virus migrates to the dorsal root ganglia and become latent at that side. It becomes latent, it hides under. And you can see the picture. You can see the picture on the right with the child, this child covered with maculopapular rashes all over the body, from the head to the toe. So that is the primary varicella chickenpox infection. This is the clinical manifestation. It's not the same as shingles, but caused by the same virus. Shingles is the recurrent. That's what I'm just telling you. Shingles is the recurrent form of the varicella, of the same virus. Shingles, which is also called zoster, is the recurrent form infection. It causes the inflammation of the ganglia and the sensory neurons. Virus can be reactivated to cause vesicular lesions, as you see on the picture on the trunk, on the picture on the right. You can see this is shingles. This is shingles lesion all over along the nape, especially the 7th and the 5th cranial nerve. What is the dynamic of infection? This is interesting. An adult with shingles can infect a child with chickenpox. Let's follow this story very well. It's really very interesting. I used to enjoy this part of the story. An adult with shingles, that is a grandpa, can infect his grandchild with chickenpox. But that child cannot infect the adult with shingles. However, a child with chickenpox can infect a susceptible adult who had not had shingles before. That child can infect. Let's follow this dynamic of infection. It's really very, very interesting. So if you are there, you have shingles, and you are playing with your baby, with your grandchild, you see after a time, you see that child developing chickenpox, you are probably the source. Of the infection. Maybe you can do that out of love, maybe through kissing and so on and so forth. Those are one way you can infect an adult with shingles can infect his grandchild with the chickenpox. Anyone who has chickenpox may develop shingles, but not everybody actually will develop. What happens after recovery from chickenpox right now? Please follow. After recovery from chickenpox, the virus enters the nervous system and stays inactive for years. And why does it stay there for years? In fact, it has been found out that the reason why it's staying there for years in the latent side, which is the dorsal root ganglia, is because of the non-coding RNA that suppresses viral replication. It's a no-coding RNA, so therefore the virus cannot replicate because the RNA is not coding, cannot replicate. And since it's not replicate, it's latent there, it's hiding there. And because it cannot replicate, it does not kill the cell. So that cell acts as a buffer for the virus. That's why it is latent. That's why it can remain there at that latent site for many, many years without showing any sign. What are those things what are the factors that lead to reactivation? Immunosuppression, stress, excessive heat and excessive cold. Those of you who like sunbathing at the beach, be very, very careful because it can reactivate. If you had chicken pox as a child, if you happen to undergo one of these factors, you may develop shingles. The virus reactivates and travels along the nerve to produce shingles. That's what I'm just telling us. 1 out of 3 will develop shingles. 1 out of 3 children will develop shingles at the adults. The signs and symptoms of varicella, exanthema maculis begin at the scalp, face, or trunk almost simultaneously. This is how it differs from measles. Measles appears little by little, but with chickenpox, spontaneous appearance of exanthema maculis, which begins at the scalp to the face and to the trunk almost simultaneously. Vesicles are surrounded by irregular erythema margin. And inside those macula, inside the maculopapular vesicles, there are a lot of the viruses. A lot of the viruses there. So which means it can also be the source of infection. What do we see? Maculopapular rashes can extend to the mucous membrane, even of the oropharynx. That's why it can be transmitted through kissing. Conjunctiva to appear in the conjunctiva and some of the time and on the female organ. Shingles, what are the signs and symptoms of shingles? Rashes begins as redness, erythema. You are seeing it at the trunk of this on the picture on the right. It's immediately followed by the appearance of blisters, very, very painful. Painful blisters because the nerve endings are affected. This is followed by the eruption which follows the path of an infected cell, of an infected nerve, usually the 7th cranial nerve. The trunk is the major area affected. In almost 50 to 60% of cases, we affect the trunk. Skin may be extremely sensitive to touch. You can understand why. The skin is sensitive because the nerve ending are affected. That is the sign for shingles. As I go to yes, at times again here, the shingles lesions are not only limited. They're not only limited to the trunk. They can even appear in the face. You can see an ugly one here. This is zoster in the head and in the face. Zoster in the head and in the face. In fact, this can eventually even lead to encephalitis. Encephalitis depending on the immune status of the patient. You can see here lesions all over the face, in the nose, in the head, on the face, in the mouth. So these are all the affecting the nerve ending in all these areas. So it's very, very sensitive to touch. What are the signs also on shingle? At times, not only in the trunk or only in the face, as I just showed us, there can be multiple lower cranial nerve pulses. This is what we are seeing here. Multiple lower cranial nerve pulses. What do we see here? This gives rise to what we know as another name of one of the complications or one of the manifestations of this same virus, Ramsay-Hunt syndrome. We see here Ramsay-Hunt syndrome caused by the varicella zoster virus. It spread to the fascia nerve. You can see it. In fact, this can even be confused. You can see the mouth bending to one side, can even be confused with stroke. But it doesn't last more than 2 weeks. This is one of the major differences. And you can see the face of the lady at the bottom. You can see all the facial nerves affected, characterized by very intensive ear pain, a rash around the pain, mouth, face, neck, and scalp, and paralysis of facial nerve. Symptoms may include hearing loss, vertigo. Vertigo, when it's in your bed, your room is circulating around you. That's vertigo. And tinnitus, sound in the inner ear. This can all be as a result of shingles. Especially if you have chicken pox as a baby. If you have chicken pox as a baby. Let's go to the next slide as I'm always coming to the end. Treatment and prevention. Analgesic to reduce the pain. It can be really very, very painful. Opiates used at times to alleviate the pain No aspirin. You see, I've just highlighted it in red. Under no occasion should aspirin be used, both to treat varicella. You use aspirin only after you have ruled out chicken pox, because aspirin will worsen. Aspirin will develop what we know as Reyes syndrome, which has actually be fatal in those children. What are the other physical means of treatment? Oatmeal bath can help relieve the itching, because there's a lot of itching because of the nerve ending that are affected. Calamine lotion can help dry out the blisters and soothe the skin. Acetaminophen, Tylenol generic, instead of aspirin. Under no occasion to use aspirin, please. Can help to reduce the fever. Antihistamine may relieve severe itching and aid sleeping, of course, can aid sleeping. A new antiviral, anti-shingles, I'm campaigning for this company. A new antiviral, anti-shingles drug is in the market now. Since, in fact, they have actually been forwarding this to me every now and then as a means of, I've also been campaigning for them. A new antiviral chingle, which is called Sovion. It's a cream. It's a cream, and it's in the market right now. So if you have shingles, please, if you have shingles, you can visit your pharmacy and get this drug. Vaccines, 3 types of vaccines. As I'm almost coming to the end now. 3 types of vaccines against varicella zoster. The same virus, 2 manifestations. Number 1 is the Varivax. Then number 2 is the Proquat, an improvement. MMR stands for measles, mumps, and rubella. But now our drug company, they have been able to couple this one with varicella vaccine, making a quadruple vaccine. Measles, mumps, rubella, and varicella against varicella. And then the third group is the Mostavax against zoster shingles. It's against zoster shingles. One good thing about all this is that both are live vaccines. They are both live vaccines. Both live vaccines. Zoster is effective in preventing symptoms of zoster. Zostavax is, let me say that again. Zostavax is effective in preventing symptoms of zoster. But the unfortunate thing, please note this is why I'm highlighting it for us in the red. The unfortunate thing is that it does not eradicate the latent state. The virus, the vaccine does not eradicate the latent state. You remember I told us the latent state is caused by a non-coding RNA. A non-coding RNA, which actually is not replicating. It's not replicating. So all this vaccine, unfortunately, does not eradicate the latent state. So that's why we have to be very, very careful. If you know those factors that may stimulate, that may reactivate chickenpox to chingle, be very, very careful, because the vaccine may not take care of that. The most current vaccine is the Shingrix. It's in the market now. We can see this every day. We can see this every day in our television advertising. Shingrix is the vaccine. It's the current vaccine now. It's the newest and most effective vaccine for shingles. Consider getting it. Please listen to this. Consider getting the Shingrix vaccine if you have had shingles. If you have had shingles, consider even getting it and receive the older vaccine. If you have had shingles but receive the older vaccine, Vostavax, consider taking Varivax. Consider taking Shingrix, sorry. Not sure, or if you are not sure, number 2, if you are not sure if you had chickenpox, if probably your mommy, your daddy did not tell you had chickenpox as a child, so consider taking Shingrix. Or if you have had shingles in the past, to prevent future occurrence of the disease, it is still very, very advisable that you take the Shingrix. It's working very well. The side effect is manageable. It's not too much. It's just the normal side effect we see in every vaccine each time we take vaccine. Actually, like I always say, side effect at times is a sign that your body, that your immune system is taking that virus. It's taking that, it's reacting positively to that virus. So it's not all the time that side effect is actually bad. So make sure the shingles rash has disappeared before getting the vaccine, before getting vaccinated. Please, this is really very, very important. Make sure that the shingles rashes has disappeared before you get the vaccine. Yes, I hope this is my last slide. I hope you have enjoyed. Please subscribe. I would like to see you subscribe. Please share. I hope you are gaining something, especially our students, my fellow colleagues, doctors, government policymakers. This YouTube is for you. Please make sure you subscribe, send to friends, and encourage them to subscribe. I will continue feeding us with more information. I hope to see you in the next flight. Once again, thank you and bye.